Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I recently taught a course at Voices of Dentistry called Enabled or Empowered. And essentially what I did was I gave dentists in the room a few steps and things to look at to really empower their hygienist to step up in how they feel about their career and also in how they contribute to the practice. Now, this can be a little bit touchy, right? Because a lot of times hygienists feel like, hey, I'm doing everything I can in the small amount of time that I have, and I totally get and respect that. I've been there, I've done that, right? But here's something that I see right after working with hundreds of dental practices all over the country and speaking to thousands of dental professionals, things that I see that dentists sometimes do that enable hygienists to be stuck in a rut. And being stuck in a rut is not an exciting and fun place to be in your career. It's actually very frustrating, and often hygienists just don't know what to do to get out of that rut, or if there is anything that they can do that's going to change anything in the practice. So here are a couple things that I see dentists do that enable their hygienists to be stuck in that rut. One is not really leading the hygienist to continually take continuing education outside of A, what is required by your state, and B, what the dentist pays for, right? So as professionals, we should always be looking for higher level continuing education that will really help us do our job better and engage us in our career, right? So dentists, the answer is to really encourage and really even, I would say, require your hygienist to take at least one CE program a year that is beyond what the state requires, right? So additional hours and beyond what you're maybe providing. I really feel like it's better for dentists to pay the hygienist well and allow the hygienist to participate in practice endorsed CE, and also giving them the resources through their compensation to take CE outside of that as well. All right, the other thing that I see dentists do sometimes that I really don't think is empowering hygienists is paying for their licensure. So hygienists, this is your professional licensure. This is your credentialing. This is your career, okay? So while that may seem like a benefit, sometimes what happens is it links you in a relationship that may or may not be in your best interest. Dentist, same thing for you, right? So just make sure the hygienists are compensated, and hygienists, this is your investment in yourself and your career. So hygienists should be paying for their own license renewal and licensure, okay? And the third thing that I see dentists often doing that empowers hygienists to stay stuck in a rut is really just not always seeing them as a colleague, but seeing them more as someone that's working for you. So how can you transfer your knowledge, your treatment philosophy to your hygiene team, and then really empower them to step into that and start having conversations with patients about needed treatment that's at the same level that the dentist would have, and then holding them accountable to that, right? So if you have created a formula for how you're going to diagnose and treat periodontal disease, hold your hygienist accountable to that, right? And if there's something that they're uncomfortable with, then open it up to conversation, right? And respect the opinions that everybody has, but really hold the team accountable to providing that care at a very high level. So I feel like hygienists that are empowered, as I have been by many dentists that I have worked with, which also means I've also been held accountable to standing up to those standards, are really, I think, more engaged and excited about their career. It's challenging and it doesn't feel like a rut. So would love to hear what you think and any other things that you see of ways that dentists empower and or enable their hygienists. Until next time, stay inspired.